Hi, welcome to Soft Serve Science, where you can get the scoop on the science of us. My name is Lili. I have a bachelor's in sociology.
My name is Eliza. I have a master's in clinical psychology.
We read excerpts. We are not experts.
So, what's the scoop?
So, when most people are born, the doctor will say, it's a girl, or it's a boy.
I thought you were going to end your sentence right there. When most people are born, the doctor will say it's a girl. And that doctor should not practice medicine.
Well, that's true. More than 50% of the population is assigned female, but that's beside the point.
Hell yeah. Girl power.
That's beside the point.
Well, what is the point?
Some people, it's difficult to say when they're born whether they're male or female. According to Interact Advocates for Intersex Youth, approximately 1.7% of people are born intersex. MedlinePlus.gov defines intersex as a group of conditions in which there is a discrepancy between the external genitals and the internal genitals. I'm going to be saying genitals a lot today.
Can you say genitals right into the microphone?
Genitals.
Oh, you didn't have to whisper it! This is our ASMR podcast about genitals. Now, what is intersex? Because if you ask me, I'm definitely into sex.
Basically, a person's genitals will be non-normative, so they might not look like you would expect male genitals or female genitals to look.
That's really interesting because genitals vary extremely widely. Of the genitals that I've seen, and I've seen a couple, just a few, and they all looked completely different from each other.
Yeah.
So what do you mean by normative genitals?
One of the types, called 46XX intersex. This person has XX chromosomes and ovaries, but they're born with fused labia and a larger than average clitoris. The flip side to this is 46XY intersex. They have XY chromosomes, may have internal testicles, and either incomplete, ambiguous, or female external genitals.
I'm confused.
In typical human fetal development, all fetuses develop the beginnings of what could become a vagina, whether they end up being a male or female fetus. In male fetuses, these will fuse. What would become the labia would fuse, and what is going to become the penis becomes the penis. Whereas in females, that stays open, and the clitoris only grows a certain amount.
So the clitoris and the penis are the same structures?
Yes, they're analogous.
So how do you decide, like, if it's small, it's a clitoris, and if it's big, it's a penis?
Yes, if there's no clear vagina, it could be considered a micropenis rather than a clitoris.
It seems like there's a lot of different factors that have to go together. You have internal and external genitals. Genitals. And you have a penis, a clitoris, a vagina, or a lack thereof, testes, XY, XX chromosomes.
Yes, and I'll also
That's a lot of stuff going on.
Oh, yeah. And one of the four main types of intersex is complex or undetermined. So someone may have just one X chromosome.
And they're fine?
Yeah, and they're fine. Or they might have XXY or 3X chromosomes.
Wait, how do you get 3 sex chromosomes?
I don't know.
I feel like if you have 3 chromosomes, it means one of your parents was a ghost.
Maybe. But this type of intersex, the complex or undetermined, typically does not affect the appearance of the external genitals, and that can be the case with intersex conditions, but it can cause issues with sexual development and hormones later down the line.
So does that mean if you have normative genitals and you've never had genetic testing, you could be intersex and not even know it?
Yes.
Wacky.
Yes. The fourth type is called true gonadal intersex. Person has XX or XY chromosomes, or both. I'm not sure how that happens. They also have ovaries and testicles, or tissues that would be an ovary would be a testicle in the same thing, an ovotesty.
An ovotesty?
Yes, it's a combination of an ovary and a testicle.
Does it have eggs or sperm in it?
I did not look that deep into this. Their genitalia can appear male, female, or ambiguous.
An ovotesty.
Yes. Now,
it's like the Bradulina of genitals.
Yes. These are all very medical, clinical ways of understanding these conditions. This website itself, medlineplus.gov, uses somewhat outdated gendered language to describe attributes related to sex as opposed to gender. So they'll say the ovaries of a woman, which is, this isn't a woman, it's a baby. But otherwise, a pretty good source for medical clinical terms.
That's something that we'll probably talk about on this show a lot, is the clinical medical, and then how that combines with the more complicated human spectrum of deciding what your life is going to be.
Yes, soft science and hard science.
Hey, we should start a podcast about this.
Speaking of outdated terms, historically, the term hermaphrodite has been used to refer to folks who have intersex conditions. This has also been used to refer to trans people. However, it is inaccurate and considered very offensive. Scientifically, a hermaphrodite is a sexually reproducing organism that produces both male and female gametes. So starfish, garden snails, earthworms, animals, not people.
It's gametes.
It's gametes. You're right, I'm running the gamete on this one.
Is hermaphrodite one of those offensive terms where we can say it, but you shouldn't call somebody that?
Yes.
Okay, so we're in the clear?
It applies to animals, not people.
Ah, okay.
When reading historic documents regarding intersex people, you may see this term. With people who are born intersex, they may have unnecessary cosmetic surgeries forced on them to normalize the appearance of their genitals.
Wait, like, in utero?
No, after birth.
But, like, immediately after birth?
Yes, in fact, in the 1950s, a team at Johns Hopkins University developed the optimum gender of rearing system for treating children with intersex. They wanted to have these surgeries done on children before they hit 18 months.
But how can a baby consent to a surgery?
They can't. Their parents would have to. And the parents would often be misled, told this is necessary. Their baby has to have this surgery to have a chance at a normal life.
I feel like if you have wacky genitals, your life is not worse off. It's just a little different.
Yeah, there are organizations who are pushing to prevent these unnecessary surgeries as they are cosmetic and not medically necessary in most cases.
So you're telling me if and I'm putting air quotes here, a girl is born with XX chromosomes, ovaries, but her clitoris is bigger than usual, they will, like, cut it off?
They will perform surgery to shorten it, or possibly move it if it's in a strange spot.
But that's so weird.
Yes.
Why would somebody care so much about the genitals of an infant?
That's a tough question to answer. Though I guess I did just research about it for a while.
I know that when I was born, my mom really wanted a girl, and so she made them take off my diaper, because she wanted to see my genitals to prove that I was female. And I guess if she saw something unexpected there, she would have been really disappointed.
And parents often can be disappointed when they have intersex babies, and rather than encourage these parents to seek coping skills, therapy, different treatments for their emotions, they will perform surgery on a baby.
I feel like I wouldn't stop someone from getting surgery on their genitals as a consenting adult, because people do that all the time. There's labiaplasties and things like that. So if an intersex person wanted to, they could get their genitals changed once they're an adult, so there's no reason to do it when they're a baby.
Exactly. So that organization I mentioned earlier, Interact Advocates for Intersex Youth, they encourage just not doing them on babies, letting people decide as adults. The idea is that an adult can make an informed decision to how they want their genitals to look. There are risks to these surgeries. They include scar tissues and chronic pain from that. They also may not be able to do sexual reassignment surgery later on in life if, as an adult, the person is trans and doesn't agree with their literally assigned gender. It may be impossible to change that.
How do intersex identities interact with transgender identities?
Intersex people, they can be trans, they can be cisgender, they can be non-binary. It's a medical condition or a medical trait rather than a gender identity. Though, of course, that's what the I in LGBTQIA+ stands for, because it does affect the gender of a person and their relation to their own body.
Yeah, so there's kind of a shared narrative for many intersex people and transgendered people that they feel like they're not allowed to just be left alone.
Yes. I want to go back to that optimum gender of rearing system. These doctors believed that a baby needed to have these surgeries by 18 months old. They needed to be given a certain specific set of genitals and be raised with the corresponding gender in order to live a happy, healthy, normal life. They would remove any supposedly incorrect gonads and treat the patient with hormones to match their assigned gender, and they would often withhold medical information from patients, or their parents in the case of minors. So many people just weren't told that they had these surgeries as babies. They weren't told that they'd had gonads removed. And in the case of having gonads removed, you have to do hormone replacement therapy for your body to live healthy. And patients would find out that they'd been lied to, which is obviously unethical to lie to patients, and would often avoid their doctors and stop treatment. Of course, children who are perceived as girls are always treated different than children who are perceived as boys. Like in any other reproductive medicine, doctors care more about preserving a woman's fertility than they care about her quality of life, though clitorectomies really have no bearing on fertility.
I hate that word that you just said. Please tell me you just made up that word.
Nope, that is an actual scientific term referring to the cutting or removal of the clitoris.
Oh, please don't say it again. I'm in agony.
And for babies perceived as boys, doctors care about the size and function of the phallus. They may choose to change the body of a baby with a micropenis to have a vagina instead.
How? What?
Yeah.
What?
They'll just open it up.
What?
They will give a baby vaginoplasty and reduce the size of the phallus. When I studied this in college, the phrase that I heard was, "It's easier to poke a hole than to build a pole."
Okay. Listen, Dr. Seuss, like, you can't do this to me.
And of course...
No, please don't continue. I just need a second. What did you just say to me?
It's easier to poke a hole than to build a pole?
Hole?
Hole.
A hole?
A hole.
There's a whole lot to unpack there.
Yes. And I suggest we throw out the whole suitcase.
Okay, keep going.
Sometimes these surgeries are necessary if, for example, the formation of the genitals blocks the urethra. So if the baby is unable to pee, then this is a necessary surgery.
I see.
Certain intersex conditions can be linked to other health risks later in life, as intersex gonads can have increased cancer risk, and certain sex hormones regulate other bodily functions, but genital surgeries have no impact on these risks. So changing the physical appearance of the external genitals does not affect the health of the internal body.
Well, I feel like it would affect... How do I put this? I feel like if you're cutting off nerves, that's going to affect somebody's ability to feel pleasured.
That's one of the many criticisms of surgeries for intersex babies is that, for example, the clitorectomy
Please don't do it again.
reduces nerve endings and can decrease sexual satisfaction later in life.
Unbelievable.
Intersex conditions are relatively rare, showing up in only 1.7% of the population, but many people consider PCOS to be an intersex condition. PCOS is an extremely common and underdiagnosed condition that causes assigned female bodies to exhibit traits associated with masculinity. So, increased facial hair growth and weight gain and higher testosterone levels and thickening of body hair. So, if it is an intersex condition, which signs point to yes, intersex conditions are far more common than we think.
Well, it's another thing where you're trying to take a spectrum and put it into a box.
Yes.
So you're saying that there's this spectrum of what human genitalia could look like, and we want to put them in the boxes of male and female. And now there's this spectrum of the different ways you can have a variety in people's gonads, genitalia, chromosomes, and presentation. And we'll put it in a box of, is this intersex or is this non-intersex?
According to, and I'm probably going to mispronounce this name, Eshikiyama Zuri, the founder of UK Mutual Aid, you can be intersex and cisgender, transgender, or non-binary. The opposite of intersex is endosex, not cisgender. When we start to accept that this is not a body behaving wrong, and it is just a body, we stop blaming and punishing people for how their bodies work and start challenging societal expectations. I want to talk about historically notable intersex people.
Please.
So first we have Gottlieb Gottlich.
It's probably Gottlieb.
Gottlieb Gottlich.
This is not a linguistics podcast.
This is not a linguistics podcast, so I will be mispronouncing a few names today. Gottlieb Gottlich was born in what is now Germany. When he was born, he was assigned female and raised as Marie Rosine. At 33 years old, Gottlieb went to the doctor with abdominal pain, and the doctor, Professor Friedrich Tiedemann, found that he was, and I quote, evidently a man with genitals of uncommon formation. She will dress herself, therefore, in men's clothes and adopt the name of Gottlieb.
Wait, the doctor made this decision?
Yes.
For Gottlieb?
Yes.
What did Gottlieb think?
Well, Gottlieb, now assigned male at 33, turned this into his career. Gottlieb, using his discovered condition to his advantage, traveled Europe and made a name for himself as a medical test subject.
Wow. A professional man.
A professional man, yeah. So he went around in England, in Germany, and in Ireland just letting doctors examine him.
Good for Gottlieb, to be
Good
honest.
for Gottlieb.
I mean, it's kind of weird that he was treated like a freak.
Yeah.
But he probably did a lot to raise awareness for a lot of doctors that didn't know any better.
And, I mean, he was born in 1798, so this is the early 1800s. Medicine was not as well developed as it is now, so it makes sense that he travels the world this way. I also have the case of Thomasine Hall, and when written, the name is Thomas, and then in parentheses, I-N-E. Thomasine is the person's birth name. They were born in 1603 in England. Throughout their life, they chose to dress as a man or as a woman, depending on what they needed. They were raised as a girl, sent to spend time with their aunt in London, where men and women would wear men's and women's fashions frequently. There was a mixing of it at the time.
Fabulous.
And that's thought to be where Thomasine got the inspiration to dress how they felt.
Now, Thomasine wasn't endosex, though. They may have been gender fluid or gender queer, but they were also intersex.
Yes, and I'll get to more on that. So they were raised as a girl, then they dressed as a man to follow their brother into the army. As an adult, they lived in colonial Virginia as an indentured servant. They lived as a man so they could work on tobacco plantations, but would dress in women's fashions as they pleased. When pressed at one point, Thomasine is quoting as saying, they dress that way to, and I quote, "get a bit for my cat," which implies that they dressed as a woman to have sex with men. That's Wikipedia's interpretation of them saying that. I can't think of any other interpretation.
Get it, Thomasine?
One day they got into legal trouble for having sex with a maid, which could be punishable if Thomasine was a man. This led to people sneaking into Thomasine's bedroom while they slept to look at their genitals.
The genital burglars?
The genital burglars. People of the town took it on themselves to find out if Thomasine was a man or a woman, so they could determine if Thomasine should be in trouble for having sex with this other woman who was a maid to another family.
I'm disturbed.
Eventually, the case was taken to the quarter court at Jamestown, where, after much deliberation, Thomasine was found to be both a man and a woman, and required to wear apparel of each. They were told they had to wear a man's garments from the neck down, and I believe it was a bonnet or other headwear of a woman and an apron.
And an apron was a woman's garment.
Yes.
Not when you wear one. That's silly. What if they weren't cooking? What if they were just, like, at the rodeo and they had to wear an apron?
It seems to me that it was common to wear aprons back then. What if you have to wipe your hands on something?
Did you just make that up, or
Yes,
is that real?
I just made that up.
Okay, we read excerpts. You gotta find an excerpt for something before you just make shit up. I can't tell you the last time I wore an apron. Maybe in high school theater? Or, yeah, when I was in the play Hansel and Gretel, I had to wear an apron as a part of my costume.
There are some people who notably are thought to be intersex, but unconfirmed. For example, Lily Elbe? Lily Elbe?
Oh, the Danish girl.
Yeah, Lily Elbe, the Danish girl, the first woman to receive sexual reassignment surgery, is thought to have been intersex.
I saw that movie. I watched it back when I worked nights on one of my off nights when I still had to stay up late so that way I could keep my schedule. I watched The Danish Girl overnight by myself.
Was it good?
It was okay. I mean, it's a drama, and
Yeah.
you're not much... You don't really like dramas, so I don't know if you would like it, which is why I watched it by myself and didn't tell anyone. But it was fine. It's just kind of weird that they cast Eddie Redmayne.
Yeah, isn't that kind of weird? The thing about Eddie Redmayne is he's got a very sharp face. Even more recently, the South African runner, Caster Semenya.
Right.
She has never confirmed herself to be intersex, but it's like a whole thing. Remember, she had to go through the different hormonal testing and whatnot to perform, and it's rumored that she has really high testosterone levels, but she herself has not confirmed it, other than to say that specific rules regarding testosterone levels in women's professional sports, like at the Olympic level, is specifically targeting her.
I feel like that one also has to do with racism.
Yes. Oh yeah, racism is a huge factor here. If she were a white woman, she'd just be fast. And she is quoted as saying, "I am a woman and I am fast."
She's just really good at running.
She's just really good at running. Very fast. To close, I would like to say that Intersex Awareness Day is October 26th.
So, if you are an intersex person who's listening to this podcast, what should you do?
There are certain organizations that are for this awareness, that are advocates for intersex people, that Interact Advocates for Intersex Youth. Their main dedication is to preventing the unnecessary non-consensual cosmetic surgeries. Intersex gonads can be more at risk for certain cancers, so monitoring for that is probably a pretty good idea.
And if you're listening to this podcast and you are endosex and you find out one of your friends or partners is intersex, what do? What's the best way to support the intersex community as an endosex person?
Yeah, you can donate to these organizations like the Interact. You can research intersex conditions. There are so many different kinds. There are the four main kinds, and most conditions fit within to those four.
educate yourself and donate to organizations that are working to help people.
What if you're listening to this because you're a parent and your baby was just born and the baby has genitals that you don't understand?
Oh, so there's a book called Raising Rosie, Our Story of Parenting an Intersex Child, written by Eric and Stephanie Lohman. Their daughter was born intersex, and they wrote a book about their experience raising an intersex child. This could be a really helpful resource for any parents raising an intersex child. It's also a very good idea to research these surgeries. If your doctor is pushing them, find a different opinion. Find out why they are pushing these surgeries, because in most cases they are unnecessary. And the best case is to teach your child about their body, be honest with them. This is going to be the case with any child, is to be honest with them about their body. And in the case of intersex children, it's recommended to be honest with your family as well, so that they know what to say to your child and how to react to your child. Don't make them feel other.
That's really interesting advice, because I feel like some intersex people would want to be open about it and some intersex people would want to keep it to themselves and not have people know about it. I feel like good advice is to not spread that around.
Yes, but that is a friend to an adult, not someone like grandma who might be changing a diaper.
I see. Why are your baby's genitals confusing to me?
Yeah, you don't want to startle grandma. You don't want someone to tell your child there's something wrong with their body just because they were born different. And additional reading would include the 2000 Anne Fausto Sterling book, Sexing the Body, Gender Politics, and the Construction of Sexuality. Thank you for listening to Soft Serve Science. If you learned something, let us know. You can also find us on Instagram and YouTube at Soft Serve Science, or email us at softservescience@gmail.com. Stay frosty.